I have cervical dysplasia. I didn't even know anything was wrong until I had a pap test and it came back abnormal. Of course, I had no idea what cervical dysplasia was, so I asked my doctor about it.
Cervical dysplasia is a condition where some of the cells in your cervix are abnormal. It isn't cancer, but it can lead to cancer if left untreated. It is usually first detected from an abnormal pap test. Most cervical dysplasia is caused by a virus called human papillomavirus, or HPV. HPV is one of the most common sexually transmitted viruses in the U.S. Genital warts are a sign of certain types of HPV, but like cervical dysplasia, there really aren't any symptoms for most HPV infections. Having an HPV infection does not mean you have dysplasia, just like having dysplasia doesn't mean you have an HPV infection. However, most dysplasia is caused by HPV infection. So chances are, if you have dysplasia, you probably have an HPV infection.
So I have abnormal cells. How bad can that be? I mean, there aren't any symptoms, and it isn't cancer.
Some dysplasia does go away on its own over time, but many types need treatment to avoid progression to cervical cancer. Right now, there aren't any medications on the market, only surgical or invasive procedures. These procedures usually involve either cutting or burning away of the abnormal tissue. Unfortunately, these procedures can't always guarantee all of the dysplasia is removed. In addition, the invasive and surgical procedures have their own associated risks. That is why doctors are testing an investigational gene therapy, not an invasive procedure, designed to work on dysplasia by finding and eliminating the HPV-infected cells in your cervix.
That sounds much better than a surgical procedure. So what's the catch?
It is important that you understand that this gene therapy is investigational, meaning that it is not available as an approved treatment, and that there is a chance that it may not work for you. The clinical research study being conducted by your doctor involves an investigational therapy for cervical dysplasia, given as an injection. The study treatment is designed to work with your body to create a natural cell-based response that circulates throughout your body to find and eliminate the abnormal cells caused by HPV.
How much time is involved?
It is also very important that you understand your responsibilities and time commitment for this study, so that women in the future may be able to someday benefit from your involvement. For this study, you will be asked to commit to completing all of the office visits. As you can see here, there are 8 visits over a 1-year period. Because we need to know if this study therapy works in your body, it is important that you come to each scheduled office visit. There are 4 different stages to this study. First, there is what is called a pre-treatment visit. During this visit, you may be asked to have a colposcopy to confirm that you have dysplasia. A colposcopy is a quick procedure, about 15 minutes, where your doctor will look at your cervix with an instrument similar to a magnifying glass. A colposcopy may be performed on you regardless of whether you enter the study, as a normal part of caring for patients with cervical dysplasia. At the time of your colposcopy, a small piece of tissue will be taken and examined to determine the type of cervical dysplasia you may have. If your tissue results show that your dysplasia level is right for this study and you agree to participate, you will come in for 3 study-related treatment visits over the first 2 months of the study. Your first study treatment visit will occur about 2 weeks after you have completed your colposcopy. During these 3 study treatment visits, you will receive study therapy by injection into the thigh by a member of the study staff. Once you have completed your study treatment visits, there is a 2-month period called the observation period, where you are monitored to see how the study therapy is working in your body. You will come in for 2 visits during the observation period at months 3 and 4 of the study. The last stage is the follow-up period. It is important that you are monitored during this stage to determine whether the HPV-infected cells in your cervix were eliminated. Remember, this study therapy is investigational, meaning that it is not proven to eliminate dysplasia and HPV. If it is found that your dysplasia was not effectively eliminated, your doctor will discuss with you about the need for invasive or surgical options.
Okay, so what else is involved?
If you choose to participate in this study, you will be compensated for your time and will be provided with all study-related care and study therapy at no cost to you. Your doctor can tell you more about this.
I talked to my doctor about it, and she said I should qualify for the study. It's good to know that there are studies out there that may give us all more options one day in the future.
Talk to your doctor about this research study